Hello, and thank you for watching. My name is Anna Clark and I work for Sirona Care and Health. I'm the Senior Programme Manager responsible for the delivery of the Neurodiversity Transformation Programme. I'm going to use this time to update you around the Neurodiversity Transformation Programme. And if you have any questions, we'll supply an email address at the end of this for you to send through any questions or requests for additional information. What is the Neurodiversity Transformation Programme? There have been national challenges relating to autism and ADHD waiting lists. This is present in Bristol, North Somerset and South Gloucestershire, as you are likely aware of. It has been agreed that a system response, the system being our local authorities, education and health services, that we needed to find a new way of working. We have had investment across Bristol, North Somerset and South Gloucestershire to introduce a needs-led approach across education and health to better support neurodiverse children and young people. It has been co-designed with families, education and health partners over the past 3 years and has been co-led with the 3 local BNSSG parent carer forums and the system. Why is change needed? You may be aware of this, as around 2 years ago, Sirona came to most SENCLO clusters across BNSSG to share the initial findings from this work and the pilot that they were launching. It was recognised that families were not and are not receiving support whilst waiting for an assessment or when needs are first recognised. Professionals reported being aware of needs, but lack of support to know how to support children and young people when they have used the tools in their toolbox and aren't sure what's next. The approach provides support without requiring a formal clinical diagnosis. What are the benefits of the needs-led approach? This brings together families, schools, health and care services to work together in a positive and practical way to help families access the support and information needed, which can evolve with the child. A needs-led approach reflects the shift away from reliance on diagnostic labels towards understanding and responding to what each child needs, recognizing that this is both a more effective and the right approach for supporting children and families. It is recognized that many children also present with high levels of needs, but do not need a diagnostic criterion, which can create inequalities. Therefore, support is essential to prevent this. What is changing? To enable the shift away from needing a diagnosis to accessing support, additional investment has been secured for Sirona 2. Create a Neurodiversity Support Team and launching a neurodivergent needs analysis to support the system and schools to better identify needs of children and young people. More information on this team will be provided on later slides. There was additional funding for the creation of a Neurodiversity Hub website to be a one-stop shop of informed information and guidance, to expand ADHD assessment capacity, to utilise an external provider to deliver needs-led support to those who have been waiting longest on the autism assessment waiting list, and to create an integrated assessment service that can assess for autism and ADHD. So the graduated response and early support. The model aligns to the I5 model of early support and interventions. Children and young people can be accessing more than one quadrant at the same time, and this aligns to the educational model of graduated response. So this is what you'll see as part of the graduated response and early support. This slide overlays the health model with the SEN graduated response model. As mentioned, the whole needs-led model has been co-designed, including with education and local authorities, to ensure that it aligns to SEND and education. It also aligns to the initial proposal for the SEND reforms. As a starting point, universal provision aligns to the first 2 quadrants of getting advice and getting help. Those children who are not making progress and who need further SEN support, which should be agreed to families and professionals. This is the getting targeted help. And this is where the neurodivergent needs analysis can be used to ensure alignment and consistent approaches are used. Recognising the learning from the SEND review in South Gloucestershire, which highlighted there are variations in identification and meeting needs, such as getting specialist help, maybe an education, health and care needs assessment and/or diagnostic assessment. Neurodivergent needs analysis. This is based on the Portsmouth Neurodiversity Support Tool. We've been trialling this across BNSSG for the last 2 years in 42 schools and additionally early years settings. The name has been changed as part of co-production with parent carers wanting to change neurodiversity, equality, diversity and inclusion groups wanting to not use the term profiling, and young people wanting to remove the word tool. So NNA, the Neurodivergent Needs Analysis, was the agreed name. It's not a diagnostic tool, but it is based on 9 areas of childhood where differences are commonly seen in those who present with neurodivergent needs, for example, sensory or energy levels. It's about looking at their presenting needs and age or developmental age to look for differences. Also recognizing needs can present differently in home and school settings. It's then thinking what else could be causing the challenges, for example, recent ill health or significant life events. Then agreeing what support can be put in place at home and school, which can be different, depending on needs and area of concern. You then agree a review timescale as per the SEND assess, plan, do and review cycle. A record will be created and reviewed throughout a child's time in education. The Sirona Neurodiversity Support Team is made up of a range of professionals. You have education psychologists, psychology, speech and language therapists, occupational health therapists, nurses, family support workers. They will train and assist professionals in education and early years settings to use the neurodivergent needs analysis to identify needs and implement earlier support. They'll complete the NNA with families for children not in an educational setting or home educated. And they will not directly work with families or children, but will advise and liaise with settings as required. This may advise referral to services if needs cannot be met with ordinarily available resources. The neurodivergent needs analysis would be the recommended first step. However, for those who are home educated or not in education, the NNAs will be done by the Neurodiversity Support Team. We do advise for children who have emotional-based school avoidance that schools still do the NNA, as learning through the pilot demonstrated that this helps identify ways that the child can be supported to attend. If the Neurodiversity Support Team complete this, they will not be able to identify strategies on behalf of the school to support reintegration. From 2028, the Neurodivergent Needs Analysis will replace the current social communication questionnaires if a child is to be referred for diagnostic assessment. So the assessment routes. For those already on the waiting list, additional investment has enabled us to expand ADHD capacity. The new integrated service can offer children a combined autism and ADHD assessment if appropriate. And there'll be use of an outsourcing provider to provide a needs-led model, which may include a diagnosis assessment if required for those on the autism assessment general waiting list. For those not yet on the waiting list, an autism and/or ADHD assessment will still be considered after a neurodivergent needs analysis if needed. Diagnostic assessment remains available where needed. And from 2028, referrals into the service will include an NNA to provide evidence of difficulties and support in place, replacing the current documentation. So there'll be phased rollout across the system. From June 2026, and this has already begun, there will be communications to parents, families and professionals across health, education and care. From September 2026, training will begin across education settings alongside wider awareness sessions for professionals. And by September 2028, the approach will be fully embedded across BNSSG. It's important to note that from 2028, all new referrals into neurodevelopmental assessment services will include a neurodivergent needs analysis, ensuring early support is consistently in place. Thank you for listening. If you do have any further questions or would like any additional information, please contact us on sirona.nd-queries@nhs.net. We will keep this email address active until September 2026 in order to capture any additional questions coming through. Thank you.